Of course, the Supreme Court is set to rule on the president's health care overhaul today. We're expecting that decision sometime in the next hour and a half to 2 hours. Joining us right now is Mike McCallister. He is chairman and CEO of Humana. And Mike, we've been running through every possible scenario here on the show. I know we don't know what the Supreme Court is going to do, but let's start with conventional wisdom, which says that the mandate will be struck down. If that happens, where does Humana stand on this in terms of, is this good news, is this bad news, and what does it mean just from doing business?
Well, it would make things very difficult. I mean, the linkage between universal coverage and the market reforms that are part of this bill is really, really critically important. The president had this right when he fought to have the market reforms linked to the requirement for coverage, and I think it's going to be a fundamental flaw and puts us on a slippery slope to a lot of market disruption in the future. Why?
Because the premiums are going to go up, because if you have people who can wait until they're sick to get health care coverage, it means that everybody has to pay more?
Of course. But look, we don't have to guess what's going to happen here. This experiment has been run in a number of states across the country in the past. In fact, in my own state of Kentucky in the mid-90s, market reforms very similar to these were put in place without universal coverage. We went from 40 companies competing in the state to 2 relatively quickly, and premiums jumped to 100%. And other states around the country have experienced the same exact thing with these reforms where there is not universal coverage.
Mike, this is Scott Gottlieb. Good to be with you. Weren't there better ways to get people into the insurance market without a mandate? Weren't there ways to create incentives to get people into the insurance market and stay continuously insured?
Well, there are other ways. This is a strong way to do it, and probably the best possible outcome would come from this. But there are other ways. You could have limited enrollment periods. You could set up some rules and structures around when people can come and go. You really just simply have to prevent people from buying coverage after they're ill. People are smart enough to know that if they can do that, they won't buy ahead of time. That makes no sense.
What about preventing people from getting re-rated or dropped if they stay continuously insured? You'd have a transition problem. You'd have to subsidize people to get into the market. You'd have to subsidize them through true hardship. But once you got them into the market, if you prevented them from getting re-rated so long as they stayed insured, that'd be a big incentive to get in, wouldn't it, without a mandate?
Absolutely. Those kind of tweaks are what probably is going to have to happen if this coverage requirement goes away. There's a number of things like that can be quite effective. I mean, at the end of the day, we all want the same thing. We want people to be able to afford their coverage and get everybody in the system. So the goals on both sides of the aisle are the same, I believe, and I think those kind of tweaks could help a lot.
Right.
Mike, your stock has gone up more than $30 a share since the health care law was passed in December of 2009. So if it's overturned, will your stock fall $30 a share?
Well, I would hope not. We've grown this company dramatically by being one of the big participants in the Medicare Advantage business, and we've really tripled the size of the company over the last handful of years. So that's primarily what's driven the stock price, and the performance on the shares has been great. We're going to be a long-term player in Medicare, regardless of what happens this morning with this bill. Medicare Advantage is going to continue to grow. We're going to continue to be a big participant in that. So the private sector, I think, is part of the long-term solution to the Medicare cost problem. We're doing much of the things that people would like to see happen with the ACO component of the bill, for example. Organizing healthcare, getting on top of implementing information technology, data analytics, case management, chronic illness management. All of those things are part of what we're doing in Medicare Advantage. So I think we're going to be a participant in Medicare over the very long term.
Mike, you're running close to your medical loss ratio floors in a lot of your segments, at least that's what's been written. Does Humana stand to gain the most relative to its peers, say, if a good part of this bill gets knocked down?
Oh, I don't know that, I look at it like that. The medical loss ratios I'm not sure they're good policy, but they're something we're going to be able to manage with. And so those are the components. If the thing gets overturned completely, we're going to have to come back to the table and figure out what's next. I mean, no one was happy with the healthcare system before this bill. The costs were too high, they're rising too fast, we all know that. So, the healthcare system is not going to be in good shape if the bill is overturned. If the bill is sustained completely, there are some things that are still going to have to change. For example, the taxes that are in the bill that are being used to fund a big portion of this fall disproportionately on small business and the seniors that are in Medicare Advantage programs. So the tax implications are going to have to be looked at. There's going to have to be some tweaks. This is a very big bill, and in these kind of cases, there's always things that have to be done over the next handful of years to make them better.
Mike, that's an excellent point, and we hope that you'll come back after we get the actual ruling to help us figure out what happens next.
I'd love to do it, Becky.
Okay. Mike, thank you very much. Appreciate your time.
See ya.